Hey guys, welcome back to the Rethink It podcast. Today we are talking about how concussions affect our brain health, chronic minor concussions. Really, we want to know, do minor concussions, like the minor common ones that everyone experiences. Do not tell me you have not hit your brain head, because I have. Okay, maybe I'm not the standard, but nonetheless, I know you've hit your head before, right? I have multiple times, and minor concussions, I mean, are super, super common. I remember knocking myself out. I think I was 6 years old or 7 years old, and I was swimming. I was on the swim team, and I was showing off for my friends, and I dove into the shallow end. You know, the one where they have the sign now on the side of the pool, and they say, "Don't dive in." Right? That was me. So I dove, and I knew how to dive into a swimming pool, but I was showing off. I was 6 or 7, and I hit my head. And it was right before we had a swim meet, right? We were going to swim a bunch of events. I think I was doing, I don't know, freestyle or something. Who knows? However, I ended up hitting my head and swimming the swim meet. Did fine, didn't think I had a problem. And then afterwards, we were having free swim with all my friends, and I was standing in line to dive off the diving board, and I started to throw up. And let me tell you, that was embarrassing for a 6-year-old who was trying to show off earlier, right? So I threw up the whole way to the locker room, threw up all the way home, threw up all night long. My mom put me in bed, not knowing what to do with a bucket. That's not what you do, FYI. So anyway, that's my first story of a concussion, and it was a pretty significant one at age 6. But my point is that everyone's had minor concussions, and the question is there a link between dementia and chronic minor concussions? Also, is there something we can do? So according to my experience in medicine, like, you have a concussion, there's not much we can do. We tell you to rest, take it easy. There's really no medications for it. There's nothing we tell you to do to prevent any kind of damage to your brain. But as my guest today will share, there is 100% link between traumatic brain injury, including the minor injuries, and Alzheimer's dementia. So this is an important conversation to have. And today I'm being joined by Michael Pendleton. He is a doctor of chiropractic medicine, and he is Dr. Chiropractics. I'm sorry if I get this wrong, Michael. But he also is fellowship trained in traumatic brain injury, and he is what we call a chiropractic neurologist. And we will talk about what that is as we go forward. So he's going to help take this apart for you guys. And we're going to dive in to all the research. And, unfortunately, we know catastrophic outcomes occur from concussions in sports. If you watch football, if you love football, if you are in the US and that's your thing, even European football is associated with brain injuries, FYI. But because of, our love for football, we are kind of a little bit more aware of the fact that TBI and repetitive TBI of a severe type, that like the kind you'll find in football, can lead to Alzheimer's and catastrophic outcomes. So I'm just going to give you guys a couple lists of the footballers that are the U.S. footballers that are casualties to this type of brain injury. We call it chronic traumatic encephalopathy when you have multiple injuries to your brain. But in case you guys follow football, here's a couple of people that you might want to know about. So we have Dave Dorson. He was a football safety who played 11 seasons for the NFL. He's considered one of the greatest Chicago Bears players of all times. Okay, Chicago Bears, here's your guy. He won the Super Bowl. He played for the Chicago Bears when they won the Super Bowl 20. And then again, when he played for the New York Giants and won Super Bowl 25. So he's a famous guy, right? He played safety. He suffered 10 known concussions during his career. And after he played football, he, became a business owner. He owned some McDonald's. I'm sure that didn't help. And as you'll hear in our upcoming podcast, acquired brain injury contributes to outcomes, okay? And if he ate his McDonald's, that probably contributed to some acquired injuries. So he began suffering memory loss after his football career ended, and he had a lot of erratic behavior, and he died, unfortunately, from a self-inflicted injury at the age of 50. So he sent a final text to his loved ones right before the end of his days, asking that his brain be used for research, asking his family to make sure that his brain is used for research. And then neurologists later did determine that he suffered from undiagnosed CTE, or chronic traumatic encephalopathy. So if we guys are listening from Georgia, we've got a Atlanta Falcons player as well, Ray Easterling. He played he had an 8-season career as a safety at the Atlanta Falcons with the Atlanta Falcons. I'm going to get this right today. So this is near and dear to my heart, coming from Georgia. I still love, even if the Falcons didn't win a lot of games, we still love them, don't we, Georgia people? So at the age of 62, unfortunately, he suffered a self-inflicted injury that was a result of years of dealing with clinical depression from dementia. And they did an autopsy, and they revealed that he was suffering from chronic traumatic encephalopathy. A year before his death, he and several other players filed a federal lawsuit in Philadelphia against the NFL for how it dealt with concussions. And I think Michael mentions a movie. I have not seen it, but it's called Concussion. And I guess it details some of this history of how the NFL has now kind of implemented some safety guidelines for concussive injuries. So, but needless to say, chronic concussions can lead to chronic traumatic encephalopathy and is a known cause of dementia and early death. But most of us here don't play for the NFL, right? So does it matter to us? I mean, does this affect us? Does it have any impact on us? The question for the rest of us is really this: does a series of minor concussions lead to a higher risk of dementia? And furthermore, are there other forms of chronic brain injury that could cause similar issues? Luckily, today I have the privilege of being joined by Michael Pendleton, as we mentioned earlier, a chiropractic neurologist. And yes, you heard me right. I did say chiropractic neurologist. He is an expert in neurological rehabilitation for conditions including Alzheimer's, TBI, and acquired brain injury and concussions. So he is published, and he has multiple published articles in the Frontiers of Neurology, and all on the topics of TBI, ABI, and Alzheimer's. So this is a very expert. I consider him my brain expert for sure. And before I introduce Michael, I don't want you to forget to support this content and help me get the information out there to others. So as you know, this content is fully funded by me, myself, and I. So I make the sincerest effort to be unbiased, clear, correct, and helpful when with the content that I produce. I'm motivated really by the desire to bless others in the way that I have been blessed myself by those who served me in my health journey. So all that to say, like, share, comment. Okay, help me bless others out there with this content. Don't forget to hit that subscribe bell icon if you're watching on YouTube, or subscribe and follow, or I think that's what you do on podcasts, right? Subscribe and follow so that you know when the new content loads, you're the first to know. So all that out of the way, let's get started. Well, Michael, welcome to the Rethink It podcast. I'm really glad you're here today. So after my introduction, I'm sure one of the main questions that people are asking right away is like, what is a chiropractic neurologist? So let's just start with that part.
It's a legitimate question. And thank you for having me on here. Basically, I have my chiropractic degree, and then postgraduate wise, I did 300 hours in a diplomat setting in neurology. And then after that, I did a fellowship in traumatic brain injuries and rehabilitation.
That's amazing.
Which was another over 300 hours with a small residency at at the time, it was a brain injury clinic down in, I think it was Marietta, Georgia, outside of
Oh,
Atlanta.
hey, go dogs.
So, yeah, so people always ask, well, are you doing chiropractic adjustments on all your concussion patients or your brain injured patients? And I'm like, no, a lot of them can't tolerate it. And
Right.
adjustments is a big part of changing neurophysiology,
Mm-hmm.
the way the nervous system functions. But um, we work a lot with looking at balance and oculomotor function, or the way the eyes work,
Mm-hmm.
and then how that works in cognition. But it's kind of cool is that when we do all of our tests, we can kind of whittle down or try to localize what's called the level of their lesion, or where are they most hurt at?
Mm-hmm.
They hurt
Mm-hmm.
more on the right side of the brain, the left side of the brain? Is it more of a midbrain or a pons or a medulla? Is it a
Mm-hmm.
basal ganglionic? And these are just little areas within the brain that we try to see, hey, this person's most injured there. And if I can do more specific treatment to that area, we
Mm-hmm.
tend to get a better outcome instead of just giving them a kind of a cookie cutter vestibular oculomotor exercise program.
Mm. Yeah, so I when I sort of looked into what you guys do as a specialty, I kind of categorized it in my mind as like like very very high level physical therapy for the brain. That's
That's a good way to put it.
kind
Yeah.
of the way
We
I
don't do we're not prescribing anything because we don't have that prescriptive right.
right.
So we're trying to change function. It's
Mhm.
not to say, oh yeah, you have a seizure disorder or you have
Mhm.
a concussion. Well, most concussions in the research says people heal from those usually
Mhm.
within a few days to a few weeks. But some people get this post-concussive syndrome and it
Mhm.
lasts.
Right.
Yeah,
Yeah.
I'm working with a patient right now, 50, about a 55-year-old female, and she's had multiple concussions,
Mm.
and some of them really have changed her balance, and she's super healthy. But we've
Mhm.
kind of localized to where her injury was at in her right midbrain. So
Mhm.
she's very hyperactive in the right midbrain, which is very connected to part of the otolithic system in her
Mhm.
ear.
Mhm.
And that doesn't
Mhm.
deal with doesn't deal with spinning like people get vertigo.
Right, right, right.
It deals with translatory issues or just she's off balance. She can't just get that balance back.
Isn't that crazy?
And at a
It's
55-year-old,
amazing.
she has the balance of a basically somebody in their 70s to 80s.
Wow.
So, but when we can get in there and we do find little ways of testing it,
Yeah.
and then we can retest to see, all right, this person's getting better and better.
Uh-huh.
And usually we have a patient in our office for a week, and about 3 hours a day, we really go after a neuroplasticity change. We would try to make them change and then teach them how to do their exercises properly. And then they go home, and we recheck them about every 4 weeks.
Do
And
you
usually,
recheck them like like a follow? So you're there
sometimes
for
like she'll
they
do
come
a
in for a
telehealth
week, 5 days, 5 days, is that right? Five
yeah,
days of therapy.
intensive physical therapy, or we call it
Mm-hmm.
a week intensive brain boot camp.
Brain
Simply
boot
put.
camp. Yeah.
Mhm.
Brain boot camp. I'm really
So
fascinated by that and what you do because I come from medicine and in my experience, I was always really profoundly underwhelmed by the tools that we had for post or for concussions. I
yeah,
remember distinctly, even personally, many, many times seeing a concussion patient in the like in the ER or even in my orthopedic when I was doing orthopedics. And I would do a CT scan and I would check them and do all the neurological testing, send them to neurology, and neurology would check them again, look at the CT scan and say, you know, they would restrict all the contact sports for a while,
rest.
and that was about it. Rest. Yeah.
Mhm.
Rest, dark room, rest, and Motrin, and that's pretty much the extent of it. But the reality is we know multiple concussions cause brain injury. So it's actually pretty pitiful in the realm of, treating, and prevention. Like, I mean, I think we have good stuff in medicine to really deal with a crisis, but it's pretty pitiful what we have to offer people for long-term prevention and brain health.
It's sad, but also a lot of them aren't trained.
Right.
My training went into this, and it was very specific for it. And there's stuff. Oh, I never knew the stuff that I know now that
Mm-hmm.
we can use. But it's unfortunate in New Mexico where I'm at is just they get what you say. The
Mm-hmm.
rest it'll go away,
Mm-hmm.
and then if not, you need to go see the psychologist,
Mm-hmm. Mm-hmm.
psychiatrist, and
Right.
because
And now you're on drugs, and
yeah,
those drugs alter your brain physiology significant. That's coming up in the next podcast.
and then
So,
and that frontal lobe, our wonderful frontal lobe, which makes us human, is very tied into that limbic system. When
mm-hmm.
that frontal lobe gets injured, you change your emotions.
Personality, emotion. Yeah.
Yes, people do. And when you feel like crap and it's not going away, I would be depressed.
Right.
Who's
Yeah.
not depressed with that?
Right.
Yeah.
Exactly. That's not the life we want to live. So, like, what are some of the tools that you use in your practice?
So
Well,
from a
especially
neuro,
let's just say in dealing with TBI, since definitely that's where
sure.
you did some fellowship stuff. So
Yeah. So
I
we
know
do
you
a
have
lot of
a lot of things.
with neurodiagnostics. I kind of want to get a good overall picture of the patient.
Mm-hmm.
You alluded to CTs and MRIs, and they're usually 90+% of the time come back normal
Mm.
because you're looking at these brain injuries are usually
You're
on,
looking at gross anatomy,
yeah, you're
not
looking at
function.
an axonal injury
Mm-hmm.
and you're looking at a cellular injury, but you're seeing a change in the way those nerves connect
Mm-hmm.
and how they then express themselves.
Right.
And
Mm-hmm.
so we use an eye tracking system to look at oculomotor
Mm-hmm.
movements. So just simply put, I can watch somebody track a target on a
Mm-hmm.
screen,
Mm-hmm.
and there's cameras there, and it will see if the eye is tracking properly. And if
Mm-hmm.
not, you'll see what's called some square wave jerk activity or catch up saccades or a bunch of
Mm-hmm.
different good words. But it tells me, all right, really simply put, your pursuit movements. And when we follow something like a car moving or a horse in the horizon, that's a
Mm-hmm.
parietal lobe, the back of
Mm-hmm.
the mid back of the brain function.
Mm-hmm.
Then we'll look at what's called saccades, which is a fast eye movement on the screen.
Mm-hmm.
So a target will flash, no flash here, flash there.
Mm-hmm.
And then we're looking at how
Mm-hmm.
fast that patient can go and are they accurate? Do they hit
Mm-hmm.
the target? Do they go past the target? Do they go or undershoot?
Mm-hmm.
Is there a straight linear line? Or are the eyes not going like this? They're going up and down.
Right.
So we check that on horizontal. We check it on vertical.
Mm-hmm.
Because when you just simply go into that part, horizontal movements from, if you remember your cranial nerves,
Yeah.
are primarily up pons or middle of the midbrain function.
Mm-hmm.
Vertical eye movements are more of a mesencephalic or midbrain.
Mm-hmm.
That's your
Mm-hmm.
that's your second. I'm sorry, your third and fourth cranial nerves. Your
Mm-hmm.
sixth is up. So we can actually even get into that much more in depth and say, all right, I don't want to do a whole lot of horizontal exercises because they're really good, but
Mm-hmm.
that patient's horrible in vertical. So
Right.
then, like, all right, I know that's more of a midbrain issue, and then from that we'll do what's called a pupilogram,
Mm-hmm.
a dynamic pupilogram. So we just use a iPad and it's a flash, and we record what the pupil does. So
Mm-hmm.
usually we have a flashlight, your pupils constrict,
Yeah.
and then they recover back to
Right.
their normal size. And so
Right.
we can use that, and with this app, it tells us how's it working right to left,
Mm-hmm.
and is there a problem with that? And then if there is, usually that is a function of what's called the Edinger-Westphal nucleus, which we'll just leave that there.
That's
But
fancy,
that's
man.
that's
I've never
part of
even
the
heard of
parasympathetic
that.
nervous system.
Oh,
That's
wow.
in the
Okay.
midbrain, and that's what
Uh-huh.
gives us this constriction and relaxation.
Oh,
So
wow.
simply put, it's much more complex than that.
Yeah, of
But
course.
then I can say, all
The
right,
body is
that person's
beautifully complex and the brain
yes,
even more so. So,
God works wonderful
love it.
things.
It's
Yeah.
amazing. Yeah.
So if I see the right pupil not doing what it's supposed to do, and then I also see the right eye on a vertical pursuit or saccade exercise, I'm like, all right, we're looking at more of a right midbrain issue.
Uh-huh.
Then from there, we'll use balance or computerized um, posturography.
Mm-hmm.
So computerized dynamic posturography, and we put people on a plate,
Mm-hmm.
and they stand and their eyes are open, and we have them measure their balance, close their eyes, and look if their balance changed, and then we put them on about 3 inches of foam
Mm-hmm.
and eyes open, and then eyes closed, and then we really challenge them with their head in rotation for 20 seconds, left rotation, flexion, and extension. And that is looking at that vestibular system. And when you look at the research in TBIs or concussions, I believe there is 90 per, or 92% of people have an oculomotor dysfunction after a head injury, and 87% have a vestibular function. That's high.
That is very high.
That's really high.
That's really high.
Most people
very
have,
statistically significant.
Most people have visual or tracking issues, imbalance issues.
Yeah.
So then we take that and a couple other tests, put those together. I do a 90-minute bedside examination with the patient because, as you know, when you examine somebody, you can really pull things out you can't see from just a simple diagnostic test.
Oh, for sure.
You cannot put all your chickens in one basket doing one test.
Right.
Unfortunately, a lot of doctors do.
Right.
With it. And so I like to look at that whole thing. And from there, I come up with all right, here's where I think your brain's most dysfunctional at. And then we set a plan to treat them with that. And that's usually that week boot camp that they're here. And then almost everybody gets better. Everybody, I want them to be 100% fixed in 1 week. It doesn't happen.
Yeah.
Especially when you're looking at multiple concussions over the lifetime. Especially if people are really ill, as you know, people who are not healthy. Diabetic.
Well, and there's the acute on chronic. So you got the TBIs that are like the physical injury. Then we have acquired brain injury, and I'm not going to use that as a bridge in a minute.
About that one,
we're going to talk about that because that's something I feel like is like more common than TBI. But then you put it on top of a TBI, it's like you've got this very complex picture. So
I hope that was a long answer, but I hope I answered your question.
Yeah, no, it's perfect. I want the audience to know kind of what you do as a specialty. Also that, that you're available for things like that, because I do think there's a limit to what I can do in my clinic when it comes to just functional support. Even with energetics, the brain actually needs some of that, so to say, physical therapy, and I don't offer that. So I want people to know that that's something that they can do and that they should do if they're in the picture of a TBI or post-concussive syndrome or even Alzheimer's prevention. I saw that you're published in a lot of that kind of research. So it's definitely a tool that people need to know about.
Agreed.
So,
thanks.
Yeah. So, but in my, in my practice, I deal with a lot with Lyme, a lot of chronic fatigue, and I feel like children, but I mean, I don't know. It feels like everybody's got some degree of injury of their brain today. I don't know if I'm just seeing it because I'm biased or if I'm just noticing that, man, everybody's brain is on fire. But let's talk about acquired brain injury. What's the difference between acquired brain injury and TBI?
So TBI is traumatic brain injury. So there's been a trauma to the head or the neck. And then acquired is usually there isn't anything traumatic. And that can come from multiple sources. That can come, number one is usually hypoxia, which is a lack of oxygen to the brain.
So post-stroke.
A stroke, or what we see is a child born with the cord around the neck. They come out hypoxic. They're being strangled, if you would say.
Right. Yeah.
That one, then you have toxic effects, which you and I have been kind of cross-trained on those things.
Yeah.
And we see Lyme, we see mold or mycotoxins, we see environmental toxins, glyphosates, the pesticides, the fertilizers. We're seeing, we were talking earlier, we see crazy parasitic infections.
Oh my gosh.
And these parasites love to harbor mold and Lyme.
And heavy metals and Lyme.
And heavy metals with it. So
I was watching, we were talking about this before. I was watching Monsters Inside Me, and I've heard about that, but I just kind of stumbled on it. I was like, let's see what they say about parasites. And they did this episode on a woman who in, I think, Rock Hill, South Carolina. And she had 3 years of abdominal pain, but not just abdominal pain, severe depression, severe, and fatigue and like light sensitivity. And it turned out she finally went to a gastroenterologist who did this. I was surprised they didn't do it sooner,
A
honestly.
fluke test?
In our practice, we do it all the time. I see it all the time in anesthesia. Boom, we're going to get an EGD and a scope and an ERCP where they look up so the ERCP looks up into the bile ducts and to the liver and the gallbladder and things like that. So she finally had that done 3 years in, and they found a massive liver fluke and then put her on antiparasitics, and she cleared all those liver flukes. And I was like, man, I have plenty of clients that have seen those in the toilet bowl. so
Now that was
yeah.
from an allopathic treatment?
Allopathic, they gave her oral
That's still pretty cool.
parasite. Yeah, so they literally saw the parasite under the scope and pulled it as a specimen and went, "You've got a liver fluke." It's just amazing because they're tiny usually. This thing was huge. So it was kind of interesting, but it was very validating because I know like plenty of my clients were like, "What are all these things that look like pieces of grapefruit in the toilet bowl?" And I'm like, "Those are liver flukes," you know. But the impact on the brain, that was what was so impressive to me. She was light sensitive and she was depressed. You were talking about the emotional part, and that is definitely something with that's really important to note because they feel crazy and then they start down the road of antipsychiatric medications,
and they can't explain it. Doctors
right.
can't explain it, so they're like, maybe I am crazy. I hear that a lot.
Of course.
It is in your head,
Yeah.
but it just is not. You can't see it.
Yes, it's organically in your head. It's not.
Bingo.
It's not like mystically in your head or whatever.
And you're not making it up.
Yes, exactly. Yeah.
Or they are not making it up.
So do you think that like pandas, I see this in the children that end up coming with their moms into my clinic, they have a lot of times they have this panda picture where their brains are on fire and they have a lot of emotional side. The kids, it's emotional, but we deal with the inflammation and the emotions clear up. Do you consider panda kind of in that acquired brain injury picture? Yeah,
I do. And personally, I've not seen a lot of pandas. I've had a couple we've diagnosed with it. But yeah, you're right. As an acquired brain injury, that can be one, and that's after they've been on they had strep.
Right. So PANS is pediatric autoimmune neurologic syndrome, and then PANDAS is pediatric autoimmune neurologic disorder associated with strep. So just for the audience, for clarification, if you guys have never heard that, that's what that is. And it's something that's recognized by even an allopathic model. I think Johns Hopkins has a whole pediatric research wing on it, but the treatment they give there would be your typical steroids because it's inflammation of the brain. So our, in our functional world, it's a little different. We don't use that approach, but what would you do so what's your approach with like a acquired brain injury?
Well, let me just add a couple more things on that acquired brain injury. I also see this with we get patients that have been drug users.
Oh yeah.
Work, addicted.
Sure, that changes the brain so much.
We have a gentleman that was on my podcast, which is called Brain Health Matters, and this gentleman, I mean, he has almost every way you can get an acquired brain injury and traumatic brain injury on top of it.
Oh my gosh.
He at birth was born with a cord around his neck, and his mom is also a patient. And she says, "Oh yeah, the doctor stopped me from doing it and shoved him back in to my uterus.
Birth control, birth canal,
to undo the cord because he was literally he was hypoxic at birth." So he had developmental delays all growing up. She tried, and she's a great mother. I mean, they still have a great relationship. This gentleman is now he's in his 40s.
Oh wow!
So he started out with that. Then he got, addicted to drugs. Lived on the streets in Phoenix.
Oh man!
He was eating out of of garbage cans,
Sure.
living like that.
Yeah.
He got in a fight, got stabbed in his left lung field. The knife was so long it went in and clipped his aortic valve.
Oh my gosh.
Then he got sick, stroked, and had a ischemic stroke up in the right parietal lobe on himself.
Mm-mm. Mm-hmm.
Cleaned up his act. Then again, if I remember correctly, then he got a brain injury, but
Uh-huh.
then he got himself clean, and they brought him to us, and he has done incredible work with it. But his big thing for him was because he had all these acquired brain injuries, he didn't know where he was at in space.
Right. Sure.
So
Sure.
yeah, so if he saw him walk, he
He
was
didn't know
walking.
what his normal was.
He just kind of walked, like his arms didn't swing, and so we found a big issue with his vestibular system. And when I got his vestibular system rehabilitated,
Mm-hmm.
probably had 60 to 70% improvement. He could actually work. He was having seizures, so his
Uh-huh.
seizures dropped
Uh-huh.
significantly. But your and I's training that we've been through, we
Yeah.
looked at some muscle testing, and I did some things with him, and his parasites and worms testing was
Oh,
off the
through the
chart.
roof. Through
Yeah,
the roof.
stuff
Yeah.
I think I ate now I would never in my life do again.
Yeah.
You get
Yeah.
stuff that's in the garbage for days. I ate.
Yeah.
So we're now doing a good detox because I got him to a good level from a neurophysiological point of view. He
Mm-hmm.
just
Mm-hmm.
he plateaued,
Right.
and
Sure.
then we did that seminar together,
Yep.
and I'm like, there is the ticket. I didn't even think about the parasitic point of this.
Oh, of course. Yeah.
When we
Mm-hmm.
do that, the charge testing,
Yeah.
0 to 1,000, he
Yeah.
was like 900s.
Oh gosh.
Just stretch toads, nematodes, tapeworms, all of them.
Oh my goodness.
And what was
So
crazy,
just for the audience sake, Michael and I have, we met kind of through a professional organization that is sponsored by a company that does a lot of education in the wellness world. And then we met kind of virtually, and then we met again in person when we
by
were
accident.
by accident,
Yeah.
yeah, at a muscle testing conference recently here in the Colorado area. That was my second time. I was kind of getting a refresher. Was that your first one
With them, yes.
with them? Okay, so
Yeah.
you were trained in a different muscle testing format, or I know
Hmm.
there's different ways to do it, but I find muscle testing to be an extremely valuable tool in the diagnostic, and I like to use it a lot to tailor down and customize my clients' treatment protocols. So that's where it's really helpful for me in my practice. So,
Agreed.
but yeah. So that helped you pick up the link with the parasites, and now
Yeah.
you're seeing.
And what was crazy, just because we're using these energetically charged vials to muscle
Mm-hmm.
test people,
Mm-hmm.
um, his mother called me probably 2 or 3 days after he was the first initial, all the testing we did on him.
Mm-hmm.
And she says, he's been having seizures like crazy. And
Oh.
I had not even put him on anything yet.
Oh
But
wow.
it's just having that around his
Oh yeah.
music field, his quantum physics,
Yep.
took that, and he was just a mess.
Oh
So
yeah.
I do a few things, then get him on some products to start to get those out of him. But I don't think I've even started a parasite product with him. I'm just getting
No.
him to
You
what
gotta
we
get
call
drainage. Yeah.
just draining him. Yeah.
My son, the reason I do this is because my son had Lyme disease, and he got very, very sick. He was 6 years old. In fact, we just wrote a book about it. Yay, a kid's book about his
Cool.
experience with Lyme. So that should be out in a couple of months. I'm excited about that. But it took us a while. It took me a while to find my way through the functional world, coming out of the allopathic world, and really understand how to utilize the tools. I actually had to really be his provider because I couldn't find one who was really Lyme literate and truly functional medicine, didn't want to bolster him with a ton of antibiotics and things like that. So anyway, I was kind of the guide in that direction. But I remember the first muscle testing conference I went to was in I think it was in Phoenix with this company. And I came back with the vials and I opened them because I wanted to muscle test them. Opened them in my kitchen. I said, "Come over here, Steven." And he was like, "Oh God, I don't feel good." What is that? I don't feel
Yeah,
good.
off,
I
off the
just,
chest.
you know, that, hold on, let me see if I've got them here. I feel like, yeah, I do. Excuse me. So, you know, we've got our little kit here. All I did was this. I opened them.
Oh, that was
I
it.
just opened them on the counter, and he was like, I don't feel good, Mom. I can't, I don't know what's going on. I don't feel
I believe
good.
it.
This was a little kid. He was 10. So he had no clue what
Yeah.
was going on. So it is definitely an unbiased and very profound reaction to the frequencies. And
And you weren't
do you,
expecting that either.
no, I did not
Oh,
expect
yeah.
it, you know, because you still, to me, it was such a new thing, this muscle testing. And I was like, what are these vials? I don't know, this is like distilled water. Is it really a frequent? I mean, I saw them do it. I did it, but do I really believe it? I don't know. You know, I was still kind of in the, this is new for me. And when I did that, it was just like, oh, well, that's pretty clear, you know?
Yeah.
So it's been a journey integrating muscle testing and frequency into my
And
practice.
that
So
makes you such a good physician to me, is because we should be skeptical
yeah,
when we learn things. We just like, oh, I believe that. I'm like, I want to test those things.
yeah,
And
I
so
test everything.
my experience with you, I never expected that to happen with that gentleman.
Hmm.
But now, even with you're saying it, it makes complete sense.
Yeah, it was just
Yeah.
too much frequency, and he had such a burden because I think I opened the one that had, because I had separated them into like the parasites and then the bacteria, and so it was all the diagnostic ones. So I had them, and then I had the mitochondria ones in a separate one, and I had all those pathogen frequencies and the glyphosates all in one box, and that's the one I opened. And he had
Wow.
such a burden of parasites. He was still going through the protocol. I think we were dealing with the deeper phase 3 type deep tissue parasites at
Hmm.
the time, but he still had a huge burden. During that time, we had started deep tissue parasite treatments, and he had like abscesses pop out of his mouth. I mean, he had all kinds of things that was pretty impressive. And it was then that I was during that time I opened up these vials, and he's like,
It's sad that we get excited
geez.
about that, but that's a good thing.
Yeah,
Because
it's
absent,
validating.
they're cleansing what's coming out of their body.
That's right. That's right. I know it's gross, but it's real. It's a purge of the bad stuff, and we want it. So back to the acquired
Amen.
brain injury.
Yeah.
This is such good conversation.
So, were you and I, when it comes to an acquired brain injury, then like I said, I like to look at the cause. You got to figure out
Hmm.
what the cause is. And that's kind of why I went to that muscle testing seminar
Right.
you did with it. So, what I have found doing this functional neurology and this rehab boot camps is some of my patients don't have the response. I'm like, what is going on with them? And then we look a
Mm.
little more of a deeper dive in their history, and then like, oh yeah, they were exposed to mold. Like yeah, I when I go back to the Midwest and I get
Hmm.
to my parents' house, I'm like I can't hardly breathe. I can smell the mold.
Mm.
Because some people can have mold exposure, mycotoxin exposure,
Mm.
or
Hmm.
Lyme, and it doesn't express themselves. It expresses
Right.
at other times.
Hmm.
So
Hmm.
that's what I'm like. There is more than going on. I just can't just do neuro rehab on all my patients, even though they need it. Sometimes
Yeah. Yeah. Yeah.
their brain injury is not from a traumatic incident. It is more from something that's
The
built up,
acquired.
acquired.
Yeah, you
And
were
in
describing
my
that
practice,
guy.
pardon,
Sorry, you were
in my
describing
practice,
that. Oh, sorry. We were like
in my
crossing over.
practice, mostly that you see a lot of mycotoxins, mold, and Lyme.
Uh-huh. Uh-huh. Oh yeah. It's incredible. Lyme disease is understated. I think that the most recent statistic I heard is that the rate is like 300,000 new diagnoses per year, and that's according to the CDC. So that's a little off. It's
Low,
probably
yeah,
more, but that's higher than the rate of new breast cancers per year. That's huge, and we don't talk about
that's
it.
huge.
It's huge.
We
So,
never talk about
no. And in fact, I think in the medical world, I put feelers out, and I'm going to just throw it out there right now. I was trying to get collect people's story of finally getting the diagnosis of Lyme disease, what kind of experience they had, because I know mine, but I was medical, so I could navigate the side eyes from doctors, because I have that training. Like I'm medically trained, so I'm like, I'm not crazy. You and
Yeah,
I
you're
trained
well
in the same
trained.
place. We trained in the same place. I'm not crazy. My son does have Lyme. And I'd get the side eye, I'd get the like, are you one of those homeschool moms that think everybody has Lyme? We do
Oh, geez.
homeschool, but I'm not, I know what I'm talking about. So it's unfortunate, but I wanted to, collect people's stories on that, because I feel like it's such a horrible pandemic of like mistreatment, because these people end up being missed. It is hard to diagnose Lyme. I mean, it's a great masquerader. The
Hmm.
symptoms are vague. It's not very clear. And in medicine, we're taught to, find a symptom, make a diagnosis, and give a drug. So it's not, it doesn't fit into that mold. So people end up going down this like multiple doctors, and then ultimately the psychiatric realm. Then they get the extra layer of being on those drugs that alter brain physiology, then that make it hard to recover from Lyme. Like that makes the treatments that you and I do more challenging. So it's kind of difficult, but I don't know why I went on the tangent. Why did I go on that tangent?
That's what I agree with
We're
you.
talking about Lyme.
Yeah.
But I was thinking earlier, you were describing that patient that was homeless. My son came out. My first child was an emergency C-section, double nuchal cord or double cord around his neck, had some hypoxia, but not, I would not say it was cerebral palsy causing, but he had profound ADHD. We lived in a moldy home. We lived in a moldy environment. Like it wasn't just the home, like the town we lived in. We lived in this deep South, and it was just, there's mold in the air. It's just part of the culture. And so he had just hit after hit after hit. And today he's doing well, but he's aware. He's 22 years old, and he's aware of his story. He's aware of where we need to be working, because when I realized it, he was like in his teens, and I was starting to try to fix and rehab the stuff that I'd done. I'd put him on the ADHD drugs. I put him on Prozac. I'd done all the medical approaches,
At what age?
and he was on ADHD drugs at 4, Prozac at 8. And I took him off of that pretty quickly, because I was like, we're going in the wrong direction. I don't agree with this. Like, I don't know I was told not to prescribe those drugs to young
Hmm.
children, and the psychiatrist was like, I do it all the time, and I was like, I don't agree. So we pulled him off, but he was my sick kid. He still is the first one to get sick. He had like multiple series of strep throat. Of course, early on, I was like antibiotic. And then when I learned, my trade, what I do now, we treated his strep throat naturally, and he never got it again, so it was amazing. But he's now taking ownership of his health, and that's a tricky part, right? When you get your kids into this teen realm, I can see how they become homeless and get addicted to drugs. I mean, I can, unless you've got this parent just who knows. How are you supposed to know? You don't know. I didn't know. So no judgment to the parents, because I didn't. But I can see how it happens, because they don't feel normal. I mean, my child on ADHD drugs versus off of ADHD drugs were two different kids. Now, on ADHD drugs, he had a ton of impulsivity, but off ADHD drugs, he just was everywhere at once, So it was an acquired brain injury for sure. And I just thank God that he didn't end up on the streets, like your patient. That,
That's God bless you for going above and beyond your training.
well, it was a humbling experience, because there are many things in medicine that we consider very untouchable. We don't talk about. No, we would never challenge these things, and you can guess what those are. There's certain things we just don't know that those are safe and effective,
Hmm.
and this is how we do things. And for me to really love my training, I loved being at PA. I loved prescribing, diagnosing. I love doing anesthesia now. I love medicine. I think it has its place, but it was absolutely a humbling experience to go, but I don't know everything. And what am I missing? And then challenge the things that were laid down as dogma, so it's still humbling. Every day it's humbling.
Amen.
Yeah, the human body is a humbling
Yeah.
organism, isn't it?
So I hope I answered your question about acquired brain injuries.
Yeah. Yeah, I think you did. It fits into that category. That's really important. And the takeaway I kind of want people to take with them is that, acquired brain injury, your exposure, let's just say it's a toxin-induced brain injury, toxin or oxygen depleted, right? Wouldn't we say, I'm just trying to make it super simple. Like, how would we
Right.
say it? If you don't get oxygen, you get toxic injury to your brain because free
Yeah.
radicals injure your brain and lack of oxygen causes free radicals. And then of course, most people think of drug use as a toxic injury, those type of things, but it doesn't have to be meth. Okay. It can be, it
Anything
can be,
in chemistry.
yeah, it can be the Roundup in your everyday food. It can be the eating out that you do every single day. And then if you happen upon a high insult of toxins, and I'll just say, like, say you have ongoing brain inflammation, and I'm gonna target anesthesia for a second because that's what I do. Say you have okay, even in the autism world, those kids have brain inflammation, right? We know they
Mhm.
do. That's what that is. In the autism community, they understand that most children should not receive typical anesthesia. Like, they encourage their parents, and I would, if you don't know this and you have an autistic kid, here's your information. Those kids get a major insult with general anesthesia, particularly with certain anesthetics that we have. And so the problem with autistic kids is they can't do for themselves, and they end up having to have multiple surgeries, and they end up getting many, many anesthetics, which ends up causing more injury to the brain. So you get this massive insult. So if you got this low grade chronic brain inflammation going on, and I'm just using autism as one that people might identify, but it can be chronic fatigue. And then you go and have a toxic insult, and I just say anesthesia because that's what I do, but you go fly on an airplane, for eight hours and be around radiation for 8 hours, because that's what happens on an airplane. You get a massive dose of radiation. That can cause injury, right? So if you have an uptick in toxin exposure environmentally, it's going to set you off and cause problems that might push you over the edge, right?
Right. And then throw
Yeah.
in EMFs on top of
Oh
that.
gosh, yeah,
All
EMFs also.
exposure.
Yeah, that's something you're going to get a lot of when you fly too. It's
Just
funny.
in life.
Oh yeah,
Yeah.
go see the towers. Isn't there was a website, and if I can find it, it shows you where all the cell towers are in your area. And those all emit EMF radiation.
Hmm.
It's pretty bad.
So the solar power is
Mm-hmm.
boxes, and we went to solar, but I use some thing called EMF rocks to
What is it
cut
called?
down EMF rocks. They
ROCKS
were
rocks.
ROCKS. Yeah, it's
Uh-huh.
nothing plugged in. It's charged rocks from the earth. It's like
Is it like
earthing, so to
shungite?
speak.
Is it like
I'm
those
not sure
shungite
what it
rocks?
is. It could be, but were you at Eco
Oh yeah, yeah,
in?
yeah.
They were there. They were one of the
Uh,
vendors.
oh, okay, okay. I'll have to look
They did
them up.
a lunch talk, and I learned a lot about the EMFs. And that's
Oh
a
yeah.
big thing when we look at brain injury rehabilitation. We try to. I'm like, you got to get away from these EMFs.
Yep.
You
Yep.
can't be on screens and need blue light blockers because that will affect your brain. So
100%.
kind of good when you're
Yeah.
talking
So
about.
yeah. So if you're a person who drives down the road by a power station and all of a sudden you get nauseated, that might be something you want to be thinking about. I've had plenty of my clients say, yeah, that's when I knew something was wrong, when I would be around power stations or cell towers, and I would feel bad. And I
Yeah.
suddenly realized that that's what that's what was going on. You know, my son with Lyme, he's finally healthy, happy, playing and running, but he tried to join the air um, Civil Air Patrol. He wanted to do that so bad. He'd been training, he'd been running, doing
Cool.
push-ups. He was so excited. He wanted to join the Civil Air Patrol. So finally the day came and we went to the Air Force Base where they meet, and it's a big deal. And he gets on the Air Force Base. He's there for 30 minutes. And this is about a year ago. This is back in March, I think. And he says, he starts turning green. He doesn't say anything because he really wants to go. He just starts feeling green. And then he starts getting the dark circles. And then his legs start getting weak. And he's like, Daddy, I got to go. I don't feel good. And I was like, oh my gosh, the Air Force Base. So I talked to my father, who's a pilot. My dad is he flies all kinds of airplanes. He flies helicopters. He flies all kinds of airplanes. And I was like, Dad, Stephen got sick at the Air Force Base. Like, what's going on? He's like, oh, yeah. We have a lot of radio communication, EMF. He says, and if you fly in the fighter jet pilots, you get a ton of radiation. He's like, yeah, we get taught that kind of stuff. And I was like, wow, okay, well,
Wow.
we're not quite there yet, are we? So we put that on hold. We're still doing some work on that. But that was one of the bigger air bases, so maybe we can find something closer. But
That's a good story. I'm gonna put that one in my back pocket.
yeah, you should
Ask
use
the
it
question.
because I mean, this child is now health. I mean, he was training. This was a child who we had to carry upstairs at his worst. He was not well. His nervous system was terrible, and he didn't have strength in his legs. We had to carry him to his bedroom,
How frightening.
and and then he got well enough that he was running 3 miles and doing push-ups and getting ready for Civil Air Patrol. But he walks onto that Air Force Base, and his nervous system said nope, nope. That's the power of EMF. So it's impressive. So talk to me about the link. This is a podcast is really, and trying to give people the tools to prevent dementia. Because in my research, what shocked me was the rates of early onset dementia. We're talking 30 to 65. Those have like massively increased 300% per year or something ridiculous like that. That might not be a specific quote, so do not quote me on that. It's something like that. Okay. So, but my point is, if it's any percent for you and you're starting to have brain changes in your 40s, that's a problem, right? So we want to
Yes.
prevent it. What do you know of the link between TBI and dementia, acquired brain injury, dementia, those type of things?
When you look at the literature, there's a definite, they say 100% link to it.
100% link
Almost link to it, yes.
to dementia.
And in multiple factors.
Mm-hmm.
And what I mean by that, and I'm going to just kind of quote, and I'm going to go very slow.
Mm-hmm.
And this is out of the, let's see, this was out of the Journal of Alzheimer's Disease from 2017.
Oh,
And it
wow.
says, what is the relationship of traumatic brain injury to dementia?
Mm-hmm.
And I'm going to share this with you so you can share this with your listeners and readers.
Mm-hmm.
But let's see what we got here. Basically, the summary states that the research points to several conclusions to a TBI dementia relationship.
Mm-hmm.
So, and they broke them down. It's not just like, oh yeah, this TBI causes dementia. Well, why or how? And
Mm-hmm.
so we'll go quickly, but I'm going to go slowly on these things
Mm-hmm.
and try to explain to them. Their first, there was 10 reasons
Mm-hmm.
that they connected to this, and the first was the increasing severity of a single moderate to severe TBI increases the risk of subsequent Alzheimer's disease, which is the most common type of dementia. So
Mm-hmm.
there's mild, which most people get. There's
Mm-hmm.
moderate, which really checks your fine, and then severe are your patients that usually are sometimes a coma,
Mm-hmm.
can't talk, they're in a wheelchair.
Mm-hmm.
We've had those patients, but the worse the concussion, the higher incidence of dementia of
Mm-hmm.
all
Mm-hmm.
types. Number two, repetitive, often subconcussive, which means not being knocked out.
Mm-hmm.
Mild traumatic brain injuries increase the risk for chronic traumatic encephalopathy, which is a degenerative neuropathology. So
Mm-hmm.
CTE. So you
Mm-hmm.
look at this, that's the big ones on the movie Concussion.
Mm-hmm. Mm-hmm.
Football players, multiple hits.
Yep.
Um,
Yep.
and I go back to this is all of us. I've had multiple hits to my head.
Yeah. Yeah.
You know, I
Yeah.
played collegiate rugby, I mountain bike, I ski, I wear
Mm-hmm.
helmets, but
Yep.
I've had multiple, and I'm like,
Yeah.
I'm in this class. I mean, we all. I mean,
Yeah.
who has not hit their head?
Yeah.
When I do
Exactly.
lectures, like who's not hit their head ever and had a little bit of concussion? Nobody
Right.
raises their hand.
Right. Right.
Maybe one person, but I think they're lying.
Yeah.
So that's number two. Number three, TBI may be a risk factor for other neurodegenerative disorders that can be associated with dementia. I think on that one, TBI goes back to our acquired brain injury.
Uh-huh. Uh-huh.
That's
Yep.
number
Yep.
four, TBI appears to lower the age of onset related neurocognitive syndromes, potentially adding TBI cognitive behavioral features. What does that mean? The younger you are and getting a TBI, the higher chance you're going to have a dementia related issue or a
At a younger
neurocognition disorder.
age.
Yeah,
Yeah.
sooner. So again, we
Yeah.
go
Sooner.
back. You're like all these people. Like, why are we seeing these things so much more? I think it's because of everything we've talked about, the EMFs, our lifestyles, things like that. And
Mm-hmm.
we've had multiple
Mm-hmm.
injuries.
Mm-hmm.
Number
Mm-hmm.
number five here is any blast or blunt physical force to the head, as long as there's a violent head displacement. So the more
Mm.
your neck
Flap out.
is injured, and
Mm-hmm.
again, the research backs this, and that's why as chiropractors, I like to really look at the neck and make sure it's stable
Sure. Oh
with
yeah.
this.
Yeah.
Or another condition which you may have come across, or listeners, is some people like, man, I gotta go back to the chiropractor every week or 2 weeks. My adjustments don't hold. When somebody tells me their
Mm-hmm.
adjustments don't hold, there's something else going on with them.
That's
And
right.
it's usually
100%.
something like this, and it's usually a vestibular issue, honestly.
That's right. Mm-hmm. Mm-hmm.
Number six, decreased cognitive and or neuronal reserve in the related variable of older age at TBI. So now, also older people who
Mm-hmm.
don't have as much up there, and
Reserve.
literally the volume loss. Their brain is shrinking as we get older.
Right.
They get a concussion. They have a higher chance of dementia.
Oh yeah. Yeah.
And aren't falls very common in older people?
Oh my gosh. Yes.
Yeah, my big thing is we want to decrease your risk of falls. You don't have a concussion.
Right.
You have a better
Right.
brain.
Right.
Number seven, the
And
presence.
vestibular rehab will decrease that risk of falls.
Very much so.
FYI. that's what I
Yeah,
want to point out there.
thank you.
You're welcome.
The presence of apolipoprotein E4 alleles, which is a genetic risk factor for Alzheimer's disease.
Yep. So these are things that
So some
I
people are
test
genetically,
for.
they have it, and we
Mm-hmm.
can test those.
Yes, we do.
Yeah.
Mm-hmm.
Do you ever use
Mm-hmm.
Cyrex Lab?
Uh, no, I use a different lab, but I do test those.
Yeah. So pretty cool that we
Yeah.
can actually test those.
Yeah.
Let's see, number
Mm-hmm.
8, acute TBI results in amyloid pathology and other neurodegenerative proteinopathies. So just
Mm-hmm.
any new
Mm-hmm.
concussion is
Mm-hmm.
going to make you start to change at a cellular level within the brain.
Right.
You start to
Amyloid is just folding of your proteins in an abnormal way. So basically your metabolism, a
Yep,
cellular mitochondrial metabolism, the ribosomes don't make them the right way and the
right.
proteins fold wrong. So that's
I,
why those amyloid happen.
I
Mm-hmm.
say you're getting scar tissue in your brain.
That's right. That's the
Yeah.
best way to describe
The
it.
older we get
Mm-hmm.
scar tissue in our shoulder, we get scar tissue in our knees, we just
Sure.
get scar tissue in the brain.
Yeah, yeah, yeah.
Let's see. Number 9, CTE, the chronic traumatic encephalopathy, shares features with neurodegenerative dementias. So they
Mm-hmm.
compare when you look at different subsets. And lastly, number 10, TBI results in white matter tract and neuronal network disruptions.
Mm-hmm.
So what you're talking about is when you enter the brain, all those connections, those highways, in which
Mm-hmm.
are billions of them, get
Mm-hmm.
injured.
Mm-hmm. Mm-hmm.
That's what you see with a neurodegenerative type of issue.
Mm-hmm.
And it says much more research is needed on this, but these 10 findings suggest that dose-dependent effects of violent head displacement in vulnerable brains predisposes to dementia.
Wow.
So, pretty incredible study with
Yeah,
this.
that's pretty critical, and that covers all of the things that we just talked about as a
Pretty
cause
much,
of
didn't it?
dementia. Yes, it did.
Yeah.
It covers all of them.
And I apologize for the big words.
No,
But
it's
I try to
I
dumb it
think our
down.
people I think our people are smart. I think
But
they can handle it. And if they have questions, comment down below, of course, or send an email to Dr. Sandy at sandybartron.com, and you will answer your questions. No problem.
sure. And
Yeah.
if you'll reach out to me, I'll be glad to answer people's questions on that one.
Yes,
You
and
know, and one when you look at this one, that those 10 things, one
mhm.
thing for me, because you had your personal experience with your son, my
Mhm.
father-in-law had, and this was probably close to 10 years ago, he had passed out twice at line at Lowe's
Mm.
and fell backwards each time. And that's the worst fall you can have because you
Oh
don't
gosh.
protect yourself.
Oh,
So he's
yes.
actually out. He had fainted. So and
Wow.
they were 2 weeks apart. The first one, the doctors didn't do anything. Oh, he didn't have too many symptoms. The second one,
Rest, hydrate.
they did a
Dark
CT,
room. CT.
found a
Yeah.
blood-brain bleed.
Oh, yeah, of course.
But he
Subdural.
was still
Yes.
pretty functional. But I'm like to the doctor, I go, well, why is he passing out? No, I don't know. He just is. I'm like, there's got to be a reason. So I
Right.
did blood tests on him, and he was
Mm.
severely iron deficient anemia.
Wow.
This
Wow.
is now what's called an acquired brain injury that
Right.
resulted into a traumatic brain injury. So
Uh-huh.
his iron levels, if you remember, I think it was like 8.
Oh,
His
wow.
total binding, its iron saturation was in either the 12 or 10% range. Unbelievable. And I
Gone.
think now my wife, his daughter,
Mhm.
um, I had already known she was anemic because she was like having fatigue issues. I had diagnosed her with iron deficiency anemia and her sister.
Mhm. Mhm.
I think
Mhm.
as a good, strong Hispanic male, he didn't complain.
Mm. Oh, of
Air
course not.
Force lieutenant. I mean, he went all 20 years in
Yeah.
the Air Force, smart as a whip, engineer.
Mhm.
And
Mhm.
now to this day, it's too late. I did all kinds of work. His
Mhm.
brain had shrunk so much from that
Oh.
lack of oxygen delivery from the anemia
Mhm.
that he has a
Mhm.
type of Alzheimer's dementia I've still never seen. He has no memory of
Oh,
anything.
no.
Yeah. He knows my
Oh,
mother-in-law's
that's awful.
name, and he's used to her, but now he doesn't remember my wife. I asked him
Oh,
about
no.
things about their pool at their old house. I would help him work on the pool. You know, he doesn't remember his children, his grandchildren.
Oh.
It's incredible.
And how
But
old is he?
he is 80,
Mhm.
81 now with
Yeah.
it. So, but
Mm.
it's incredible what the brain does because he just keeps eating and functioning, but he wants to be
Mhm.
fed all the time. He probably weighs 130 pounds.
Yeah, yeah, yeah.
And he just
Wow.
eats everything. And it's just that brain wanting that,
That
unfortunately, that
nutrient.
crappy
Give me some
fuel.
glucose, but the problem is the glucose doesn't get
Yeah.
to the
And
brain as well in
and we've
those
tried to change
situations.
diet, but my
Yeah.
mother-in-law gives up. You know, it's hard to treat family.
That's right. It is so
So,
hard. It is
so
so
that
hard.
he falls into this almost all those with it
Uh-huh.
because I've
Uh-huh.
never checked him for a genetic factor, but I
Mm.
think I might check at least my wife and then the
Yeah.
rest of her family with it. So it's
Yeah.
pretty interesting.
Well, and to when it comes to iron deficiency anemia, especially when you have tremendously low or tremendously high ferritin, you're dealing with a chronic inflammatory problem, and then also parasites.
Yeah,
Parasites love to eat the
yeah.
iron from the red blood cells. So metals, they love metals. So,
Mhm.
that'd be something I would be absolutely checking for, maybe babesia or something like that loves to just destroy the red blood cell. Yeah. Wow. That's
Yeah.
impressive. So, yeah, that's a great way to finish the story of TBI and ABI, or acquired brain injury. So I always leave people with a little hope instead of just bringing them down all the time. So, of course, I want to give people practical information, practical tools that they can use to biohack their brain and optimize their longevity. So, what kind of tools, supplements, strategies do you recommend just to the average person to help biohack their brain? I mean, I always tell them light, cold plunges, good diet.
Yeah.
This type of
And that
thing.
one, the one that in our podcast, Brain Health Matters, we consistently it's move, exercise.
Move your body.
You look back at the research. What's one of the best things you can do for your brain is move.
100%.
Yeah, and the best thing you can do for your brain, learn and dance.
Learn to
Learn and
dance.
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 Yeah,
Oh,
in the
I
research.
love this.
You got to
This is
learn the
fun.
steps. It's
Yeah.
cardiovascular.
Yes.
It's really cool. And
Yeah, it's like chess except with movement.
it is. Yeah, and it's fun, and it brings back people's old memories. So my big thing is move.
Move your body.
Drink plenty of good water, distilled or reverse osmosis water, and you gotta stop eating shit.
Yes.
I mean, you just can't eat sugar all day long, which is
Yeah.
everywhere.
Yes. Yes.
Yeah, those are our big three that we do.
Yes. Remember, dementia is type 3 diabetes. So get the sugar out of your diet and increase that
I'll tell
protein.
a quick study that they did with exercise. They took over 65 year of age, male and female marathon runners, MRI their brain, looked the volume of their brain, especially in the hippocampus, which is in the temporal lobes, which is our short-term memory, made them stop running for a month. Redid the MRIs. The only area that the brain changed was the hippocampus shrunk.
Oh my gosh!
The memory of the brain shrunk.
Okay, the hippocampus is a memory part of your brain, people.
Short-term memory.
Yeah.
Why are we like, wait, what did I come to this room for? Why did where's my keys? Those things.
Yeah. Yeah.
They then let these people go back to running. Then they MRI'd them at 2 weeks and at 4 weeks. And I think it was at 6 or 8 weeks, their brain was back to the original volume.
Wow.
So it shows what stopping, somebody who's exercised, what stopping does.
Wow.
And then it can come back pretty quickly. Yes. Now, I think personally, it came back quickly because these people were healthy. They had that substrate in there. They had that memory with that.
Sure.
So that's one of probably the coolest studies I've ever come across.
Yeah. Somebody said it really simply. I don't know where I heard this, but somebody said, when we stop challenging ourselves, our bodies just start to disintegrate. If we just go for comfort, and I think as we age, we tend toward comfort. I stay inside; it's cold, so I don't go outside. So we don't do the cold plunge. We stop exercising as much. Our joints hurt. We just tend toward this comfort, but that's actually just incredibly deteriorating for the body. It's not it's the opposite of what you need to. You need to continue to challenge your body. And the movement is really great. I'm glad you mentioned it because I did mention in a previous podcast that there's a lot of push in the supplement industry. And I do love my supplements. I give them when needed and how needed. But one of the big brain supplements that are huge right now is BDNF, right? Well, we make more BDNF when we move our muscles, and we don't have to move them really hard. You don't have to run marathons to do it. You can just go for a brisk walk, And I'll tell you, in my practice, that's the hardest thing for me to get people to do. The dietary changes, because it involves the lifestyle and moving your body. I get so much pushback. These things, I want to save you money. We don't need to take these supplements. We just move your body,
Yes.
So yes, that's awesome. I love
Amen.
it. I love it. Dance, people. Dance until you die. I love it. All right. Any last thoughts for us before we wrap it up?
No. If anybody wants to see where I'm down in Albuquerque, my website's swww.swbrainpc.com. Southwest Brain Performance Centers. swbrainpc.com.
And all that will be in the show notes. And if you're on our emailing list, that will be emailed out to you as well. So make sure you are subscribed so you get all the information.
Yep.
But for sure, check our show notes for that information. You can get in contact with Dr. Michael at SBS, what is it? Southwest Brain Performance.
Yeah, swbrainpc.com. Thank you for having me. This was a blast. You and I could talk for another 3 to 5 hours.
Yes. We had a fun time talking before this podcast. So I just enjoy this. It's so relaxing and validating to me to talk to other people in this space, because sometimes I feel like I'm a lone island over here. I promise I'm not crazy, people. Like, this is what you need to
Especially with
do.
separate specialties too. That's the best part.
Yes, exactly. All right. Well, I'll talk to you guys soon. Thanks so much for your
All right.
time. And I'll talk to you guys soon. Bye.
Good night.
My hope is that this podcast has left you with a few new insights, hopefully some encouragement, and most importantly, some actionable steps forward toward healing your body and your brain. If you found this content helpful, please don't forget to give us a like and share it with someone else who might benefit from it. Also, don't forget to follow us on our Instagram and Facebook pages. I love hearing from you guys. I look forward to spending some time with you again soon. So until then, celebrate the small victories. There really is hope for lasting healing.